got my Hawaiian shirt ready for it, Scott. The WWAY Health Fair is Thursday, just 2 days away. We have a lot of vendors and information at Independence Mall in Wilmington available to you 10 a.m. to 3 p.m. And as part of our lead up to the event, we're introducing you to some of the doctors who will be on hand for the event. Today, Dr. Andre Alfanador talks about the importance of having a primary care doctor and taking preventive measures for your health.
So my job is really to coordinate their care. So a lot of patients require a lot of different specialists. So I can work with their cardiologists or their lung doctors or their stomach doctors if they need to help coordinate their care. But our most important job is to do preventative health care. So we monitor them, we get to know them so we can keep them as healthy as we can.
What are the benefits of going to a doctor, but let's say a primary care before you get sick?
Yeah, sure. So that's where our benefit really comes in. So we can screen you for conditions like high cholesterol, high blood pressure, or being overweight or obese, so that we can do things early on to prevent those conditions, one, from coming on, two, from getting you sick, or three, ending up in the emergency room or in the hospital. Obesity is one of the things that's running rampant across the U.S. So there's a lot of things that we can do to recommend for weight loss, eating right, healthy lifestyle choices, quit smoking, recommended intake of alcohol, that kind of thing. A lot of different things that we can do and suggestions that we can make so people can stay as healthy as possible.
With the health fair that we have coming up next week, what will you be out there doing?
That's a great question. So we're going to be out there basically to interact with the community. One of the primary things that we're going to be doing is blood pressure screenings and just sort of educating people on what they can do to help prevent disease, and also on things that we can do to help counsel them on getting into a primary care doctor, what a primary care doctor does. And we're actually going to have some primary care doctors, including myself, out there to say, hey, this is what we do, this is who we are, come get to know us and don't be scared. I consider myself like a coach, right? So they can come to me, I help coordinate their care, we can determine where they need to go from there. So in primary care, we can do lab work, we can do some basic x-rays and things like that, determine if they need specialists, but we're the coach, so I help them through it, they can come to us, ask us questions. We're there to help them out and sort of guide them through the whole process. Hopefully, they just need a primary care doctor. We can get to know them and keep them healthy. But if things do come up, then we can send them where we need to go, where they need to go if they need to go anywhere, or we can keep them and keep them as healthy as we can.
And there will be all kinds of coaches at Independence Mall on Thursday, just like the doc there.